Heart disease. The name itself carries a weight, a sense of foreboding. But what exactly is heart disease? It's not just one ailment, but rather an umbrella term encompassing a range of conditions that affect the heart's ability to function properly. This includes coronary artery disease, heart failure, arrhythmias, and valve problems, among others. Consider this: heart disease is the leading cause of death for both men and women in many parts of the world. That's a sobering thought. Every year, it claims millions of lives, often silently, without warning. Many people don't realize they're at risk until it's too late. Why is it so crucial to address this proactively? Because unlike some health challenges, heart disease is often largely preventable. We aren't powerless against it. We hold a significant amount of control over our cardiovascular health through the choices we make every single day. The good news is that you don't need drastic measures or extreme overhauls to make a difference. Small, consistent changes to your lifestyle can have a profound impact on your heart health and overall well-being. We're talking about incorporating more fruits and vegetables into your diet, finding ways to be more physically active, managing stress effectively, and saying goodbye to harmful habits like smoking. Imagine a life filled with energy, vitality, and the freedom to enjoy your favorite activities without the worry of heart problems holding you back. That's the promise of a heart-healthy lifestyle, and it's within your reach. Let's explore how you can take simple, practical steps to safeguard your heart and build a brighter, healthier future. So, if simple changes can make such a difference, where do we even begin? Understanding the factors that contribute to heart disease is the first crucial step. Think of it like understanding the landscape before embarking on a journey. You need to know the terrain to navigate it successfully. When it comes to risk factors for heart disease, we can broadly categorize them into two groups: modifiable and non-modifiable. Non-modifiable factors are those we can't change, things like our age, our genetics, and our gender. For instance, the risk of heart disease tends to increase as we get older, and a family history of heart problems can also elevate our risk. While men generally have a higher risk earlier in life, women's risk increases after menopause. But before you feel discouraged by these unchangeable aspects, let's focus on what we can control: the modifiable risk factors. These are the aspects of our lives that we can actively influence to significantly reduce our risk of developing heart disease. And this is where the power of simple lifestyle changes truly shines. The big players in this category include our diet, our exercise habits, whether or not we smoke, how well we manage stress, and our weight. These factors are interconnected, and making positive changes in one area can often have a ripple effect on others. For example, adopting a healthier diet can lead to weight loss, which in turn can improve blood pressure and cholesterol levels. Even if you have non-modifiable risk factors, making positive changes to the modifiable ones can significantly impact your overall risk profile. It's about taking control of what you can and mitigating the impact of what you can't. Let's dive into these modifiable risk factors, starting with the cornerstone of heart health: our diet. Let's talk about the cornerstone of heart health: your diet. What you eat has a profound impact on your cardiovascular system, influencing everything from your cholesterol levels to your blood pressure. But a heart-healthy diet isn't about deprivation. It's about abundance, an abundance of delicious, nourishing foods that support your well-being. The key is to focus on incorporating more fruits, vegetables, whole grains, and lean protein into your daily meals. Think vibrant salads bursting with colorful produce, hearty bowls of oatmeal, topped with berries, and grilled chicken or fish served with a side of quinoa. On the other hand, it's important to limit your intake of saturated and trans fats, cholesterol, sodium, and added sugars. These can contribute to plaque buildup in your arteries, raise blood pressure, and increase your risk of developing heart disease. Where are these lurking? Often in processed foods, fried foods, sugary drinks, and fatty cuts of meat. So, how do you put this into practice? Start with small, manageable changes. When grocery shopping, spend most of your time in the produce section, stocking up on fresh fruits and vegetables. Read food labels carefully, paying attention to serving sizes, saturated fat content, and added sugars. For meal planning, try to incorporate at least one fruit or vegetable into every meal. Experiment with different recipes that use whole grains like brown rice, quinoa, and whole wheat pasta. And when cooking, opt for healthy cooking methods like baking, grilling, or steaming instead of frying. Need some inspiration? How about a breakfast of Greek yogurt with berries and a sprinkle of nuts? For lunch, a hearty salad with grilled chicken or chickpeas, and for dinner, baked salmon with roasted vegetables and brown rice. Small changes, big impact. Now, let's move on to another crucial element in the fight against heart disease: exercise. Think of physical activity as your heart's best friend, a powerful ally that strengthens your cardiovascular system and improves your overall health. Regular exercise offers a multitude of benefits, including lowering blood pressure, improving cholesterol levels, helping you maintain a healthy weight, and reducing stress. It essentially fine-tunes your heart's efficiency, making it stronger and more resilient. So, what kind of exercise is best for your heart? A combination of aerobic exercise and strength training is ideal. Aerobic exercises like brisk walking, jogging, swimming, and cycling get your heart pumping and improve circulation. Aim for at least 150 minutes of moderate-intensity aerobic exercise or 75 minutes of vigorous-intensity aerobic exercise per week. Strength training, on the other hand, helps build muscle mass, which can improve your metabolism and help you burn more calories even when you're at rest. Focus on working all major muscle groups: legs, arms, chest, back, shoulders, and core, at least 2 days per week. But what if you have a busy schedule? The key is to find ways to incorporate more movement into your daily routine. Take the stairs instead of the elevator, walk or bike to work or errands, or schedule short exercise breaks throughout the day. Even 10 to 15 minutes of activity can make a difference. One of the biggest barriers to exercise is often lack of time or motivation. Try finding an activity you enjoy, exercising with a friend for accountability, or setting realistic goals and rewarding yourself for achieving them. Remember, every little bit counts and consistency is key. Now, let's address one of the most significant and destructive habits when it comes to heart health: smoking. The impact of smoking on your cardiovascular system is devastating. Plain and simple, that it damages blood vessels, increases blood pressure, reduces oxygen levels in the blood, and makes blood more likely to clot, dramatically increasing the risk of heart attack and stroke. If you smoke, quitting is the single most important thing you can do for your heart. It's not easy, but it's absolutely worth it. The benefits of quitting start almost immediately. Within just 20 minutes of your last cigarette, your heart rate and blood pressure begin to drop. Within a few months, your lung function improves, and your risk of heart disease starts to decline. So, how can you kick the habit for good? There are many effective strategies and resources available to help you succeed. Nicotine replacement therapy, NRT, such as patches, gum, lozenges, and inhalers, can help reduce cravings and withdrawal symptoms. These are available over the counter or with a prescription. Support groups and counseling can provide emotional support and guidance as you navigate the challenges of quitting. Many hospitals and community organizations offer smoking cessation programs. Talking to a therapist can also help you address the underlying reasons for your smoking habit and develop coping mechanisms for dealing with stress and cravings. Prescription medications, such as bupropion and varenicline, can also help reduce cravings and withdrawal symptoms. Talk to your doctor about whether these medications are right for you. Quitting smoking is a journey, not a destination. There will be challenges along the way, but don't give up. Celebrate your successes, learn from your setbacks, and remember that every cigarette you don't smoke is a victory for your heart. Let's turn our attention to a less obvious, but equally important, aspect of heart health: stress management. In today's fast-paced world, chronic stress has become almost ubiquitous, and its impact on our physical and mental well-being can be significant. But what's the connection between stress and heart disease? When we experience stress, our bodies release hormones like adrenaline and cortisol, which can temporarily increase heart rate and blood pressure. While occasional stress is a normal part of life, chronic stress can lead to long-term cardiovascular problems. It can damage artery walls, increase inflammation, and contribute to unhealthy habits like overeating, smoking, and inactivity, all of which further elevate the risk of heart disease. That's why finding effective ways to manage stress is crucial for protecting your heart. The good news is that there are many techniques you can incorporate into your daily life to promote relaxation and reduce stress levels. Meditation, even just a few minutes a day, can help calm your mind and lower your heart rate. Yoga combines physical postures, breathing techniques, and meditation to promote relaxation and reduce stress. Deep breathing exercises can help you calm your nervous system in moments of anxiety or tension. Spending time in nature has been shown to lower stress hormones and improve mood, and pursuing hobbies and engaging in activities you enjoy can provide a healthy outlet for stress and promote a sense of well-being. The first step is to identify your personal stressors. What situations or events trigger feelings of stress or anxiety? Once you're aware of your stressors, you can develop coping mechanisms for dealing with them. This might involve setting boundaries, learning to say no, delegating tasks, or practicing self-care. Remember, taking care of your mental health is just as important as taking care of your physical health. Now, let's address the connection between weight and heart health. Maintaining a healthy weight is essential for reducing your risk of heart disease and improving your overall well-being. Excess weight, particularly around the abdomen, is linked to increased blood pressure, high cholesterol levels, insulin resistance, and inflammation, all of which can contribute to cardiovascular problems. One common tool used to assess weight is the body mass index, BMI, which is a measure of body fat based on your height and weight. While BMI isn't a perfect measure, it can provide a general indication of whether you're at a healthy weight. A BMI between 18.5 and 24.9 is generally considered to be within the healthy range. It's important to remember that even modest weight loss can significantly reduce your risk of heart disease. Losing just 5 to 10% of your body weight can improve blood pressure, cholesterol levels, and blood sugar control. It's not about striving for an unrealistic ideal, but rather about making sustainable changes that improve your health. The most effective approach to weight management is a balanced combination of diet and exercise. Focus on eating a heart-healthy diet rich in fruits, vegetables, whole grains, and lean protein, while limiting processed foods, sugary drinks, and unhealthy fats. Incorporate regular physical activity into your routine, aiming for at least 150 minutes of moderate intensity aerobic exercise per week along with strength training exercises. Be patient and persistent and focus on making gradual, sustainable changes rather than trying to overhaul your lifestyle overnight. Celebrate your successes along the way, and remember that even small steps can lead to significant improvements in your heart health. While lifestyle changes are incredibly powerful, they're not the whole story. Regular checkups with your healthcare provider are also essential for protecting your heart health. Think of these visits as tune-ups for your cardiovascular system, allowing you to monitor your progress and identify any potential problems early on. During these checkups, your doctor will typically check your blood pressure, cholesterol levels, and blood sugar levels. These numbers provide valuable insights into your overall cardiovascular health and can help identify risk factors that may need to be addressed. Blood pressure readings indicate the force of your blood against your artery walls. High blood pressure can damage your arteries and increase your risk of heart attack, stroke, and kidney disease. Cholesterol levels, including LDL, bad cholesterol, and HDL, good cholesterol, can indicate your risk of plaque buildup in your arteries. High blood sugar levels can indicate insulin resistance or diabetes, both of which increase your risk of heart disease. Regular screenings allow for early detection of these risk factors, enabling you and your doctor to take proactive steps to manage them. This might involve lifestyle changes, medication, or a combination of both. Early detection and intervention can significantly reduce your risk of developing serious heart problems. Don't wait until you experience symptoms to see your doctor. Schedule regular checkups even if you feel healthy. The frequency of these checkups will depend on your individual risk factors and your doctor's recommendations. Be open and honest with your doctor about your lifestyle habits and any concerns you may have. They are your partner in protecting your heart health. Now that we've covered the key elements of a heart-healthy lifestyle, it's time to put it all together and create a personalized action plan. This is where you become the architect of your own cardiovascular health, designing a roadmap to a brighter, healthier future. The first step is to assess your own risk factors. Consider your family history, your lifestyle habits, and any existing health conditions. Are you a smoker? Do you struggle with stress management? Do you have high blood pressure or cholesterol? Be honest with yourself about your strengths and weaknesses. Next, identify areas for improvement. Based on your risk assessment, where can you make the biggest impact? Perhaps it's quitting smoking, adopting a healthier diet, increasing your physical activity, or learning stress reduction techniques. Choose one or two areas to focus on initially, rather than trying to overhaul everything at once. Set realistic goals. Instead of aiming for perfection, focus on making small, sustainable changes. For example, instead of trying to run a marathon, start with a daily walk. Instead of cutting out all processed foods, try swapping sugary drinks for water. Create a personalized action plan. Write down your goals and outline the specific steps you'll take to achieve them. Be specific, measurable, achievable, relevant, and time-bound. SMART goals. For example, I will walk for 30 minutes 3 times per week for the next month. Track your progress and celebrate your successes. Keep a journal to track your food intake, exercise habits, and stress levels. Acknowledge and reward yourself for achieving your goals. Remember, this is a journey, not a destination. There will be ups and downs, but the key is to stay committed to your plan and celebrate every step you take towards a healthier heart. We've reached the end of our journey, and I hope you're feeling empowered and inspired to take control of your heart health. Remember, preventing heart disease doesn't require drastic measures or overnight transformations. The power lies in simple, consistent lifestyle changes that, over time, can make a profound difference. We've explored the importance of a heart-healthy diet, regular exercise, smoking cessation, stress management, weight management, and regular checkups. Each of these elements plays a crucial role in protecting your cardiovascular system and improving your overall well-being. If you take nothing else away from this discussion, remember this: it's never too late to start making positive changes. Whether you're young or old, healthy or dealing with existing health conditions, you have the power to improve your heart health and live a longer, more fulfilling life. Don't be discouraged by setbacks or challenges. Every small step you take towards a healthier lifestyle is a victory. Celebrate your successes, learn from your mistakes, and stay committed to your goals. The future of your heart health is in your hands. Take the first step today. Commit to making one small change that will benefit your heart. Schedule a checkup with your doctor. Try a new heart-healthy recipe, go for a walk, or practice a few minutes of meditation. Your heart is the engine of your life. Treat it with the care and respect it deserves. By making simple, sustainable lifestyle changes, you can build a brighter future for your heart and enjoy a longer, healthier, and more vibrant life. Take action now, and let's create that healthier future together.